1, 2, 3, ready?
Pfizer and BioNTech have asked U.S. health regulators to authorize their COVID-19 vaccine for children 5 to 11 years old. The FDA may clear the shot for use in that age group before November, which could mean pediatrician offices, schools, and pharmacies are able to begin distributing doses between Halloween and Thanksgiving. This news is welcomed by many parents of vaccine-ineligible children, who have watched nervously as schools reopened and pediatric COVID-19 cases rose, fueled by the highly contagious Delta variant. In the first week of October, there were nearly 150,000 new child COVID-19 cases reported in the U.S., which accounted for almost a quarter of total new cases reported nationwide. Public health experts say vaccinating children is crucial to protecting them from infection and achieving community-wide immunity. But the percentage of vaccine-eligible children who are fully vaccinated lags behind adults. Many parents of children who are still ineligible say they will vaccinate their children as soon as the shot is authorized. But other parents are hesitant, sometimes even when they've been vaccinated themselves.
If I would do it to myself, why isn't it good enough for my daughter? But then you kind of bring in all of those parental aspects of wanting to protect them and do the right thing and possible guilt if there's vaccine injury and all of the unknowns. And you just get kind of thrown back into this whirlwind of, oh my gosh, what is the right decision here?
A recent survey by the Kaiser Family Foundation found that if authorized, 34% of parents said they'd vaccinate their 5 to 11-year-old kids right away, while 32% said they would wait and see.
I do think that maybe not being the first in line and allowing other children to go first who want to be first in line, once vaccines are given to a mass population, will then probably have a lot more real life data on how it affects our children.
I think it's an incredibly natural human instinct to protect our children. And I think sometimes in things that there are questions or if there's unknowns, it's a little bit easier for us to take that risk with ourselves than it is with our babies, with our children. I think it's important to remember that there are many, many known risks to COVID infections. The risks of vaccines are far more theoretical.
Kathy, who is vaccinated, says she'd like to see more data from the trials before coming to a decision on vaccinating her 8-year-old daughter.
I believe in science. I believe that the facts are there. I do, however, wish that the data from the trials was more available to the public and also sort of in layman's terms, as opposed to being hard data to process and really sort through yourself.
With the potential authorization of Pfizer's vaccine in younger children on the horizon, pediatricians across the country are working to share information about the vaccine with parents. One challenge, they say, is that the public health message over the last year has been that kids usually don't get very sick from the virus. Dr. Gamble says there are 3 main points that she tries to hit during conversations with families.
The first thing to remember is that we know the vaccine works. From studies in adults, we know that the vaccine helps prevent disease. And we also know that vaccinated individuals that do catch COVID are far less likely to suffer from severe complications or to die. I have every reason to believe that the vaccine will be just as effective in kids.
The second reason is that we know children spread the virus that causes COVID-19 disease. Even children that have no symptoms can spread COVID-19, and the vaccine helps decrease this spread.
The third consideration is really thinking about the broader impact that this pandemic has had on kids' mental health and well-being. Every single day, I'm seeing the physical and emotional manifestations of chronic stress on our children.
Pediatricians say a common question they hear from parents is about the possibility of unknown long-term side effects from the vaccine, because it's new.
That's not a question that I haven't heard before. The pneumococcal vaccine, the vaccine to prevent Haemophilus influenza type B, chickenpox vaccine were all vaccines that I've seen developed in my career. And those questions came up before. And the answer today is what it was then. The studies that we've done to look at this vaccine have shown that it is safe and there's no expectation of anything happening long term. With those other 3 vaccines, that has proven to be true. The population of children that I'm actually immunizing now are the children of those people that I immunized for the first time with some of those particular vaccines. And so I can point to them when I see that mother that I took care of as a child and say, you came out okay.
Dr. Patterson says he's also worked to allay specific concerns about fertility, myocarditis, and pericarditis by sharing data and research with families.
Continuing to help them understand how science is paying attention to side effects, how we are capturing potential problem areas, and how we are really making a difference in the outcome that people are having. Those are some of the ways to convince or encourage those who take the wait and see approach that now is the time.
Should the FDA greenlight the vaccine for young children, they would get 2 injections 3 weeks apart, like adolescents and adults, but at a lower dosage. After the authorization in 5 to 11-year-olds, the only group left awaiting vaccines will be children as young as 6 months. Pfizer has said that results from a study in younger children, ages 6 months to under 5 years, could come towards the end of 2021.